Crystal-induced arthritis part 5. The objective is report management strategies of gout, both acute and chronic prophylaxis. So when a person has acute attack of gout, you have to extinguish that fire. The fire as in the inflammation going on in the joint. There are several strategies to take care of the acute attack of gout. You can give steroids or prednisone. You can give it orally or directly inject it into the joint. You can give non-steroidal anti-inflammatory drugs like naproxen or meloxicam or indomethacin. You could also give colchicine or anakinra. And let's discuss the mechanism of action of these drugs in a little bit detail. So as you can see in this diagram, this flow diagram shows mechanism of action of non-steroidal anti-inflammatory drugs. As you can see over here, NSAIDs inhibit COX-1 and COX-2 enzyme and therefore prevent pain and inflammation. So remember, these medications are to reduce the symptomatic issues with gout. Similarly, corticosteroids or glucocorticosteroids inhibit the phospholipase A2 and thereby decreasing pain and inflammation. Again, a symptomatic management therapy for acute gout. If you remember this diagram from our part 2 of the gout talk, I have purposely used the same diagram just to orient you a little bit to this diagram. What we said is when the urate pool exceeds the saturation point, uric acid crystals deposit in the joints and the area around it. This initiates the innate immune system to act and it calls on macrophages and neutrophils by the way of chemotaxis. Colchicine is a medication that inhibits neutrophil chemotaxis and therefore inhibits the inflammation and the pain and the redness and the loss of function of the joint in acute gout. Anakinra is a biologic medication. It is an inhibitor of interleukin-1 receptor and therefore inhibits the inflammation. Now that was management of acute gout. Now let's talk about management of chronic gout, that is treatment to inhibit future gout attacks. For this, I would like you to think about a bathtub analogy. So imagine the water in the bathtub is actually urate pool. So the sources of getting urate pool or the water in this bathtub would be from diet or would be from cell turnover, etc. Correct? Now, when the bathtub or the uric acid or urate pool goes beyond what the capacity of the blood is, then there is a dripping of water from the bathtub or dripping of urate from the pool, thus giving rise to gout. So our mission, our strategy is to prevent any overflow of urate from this bathtub. And what are some of the strategies that we could undertake? We could either open up the drain by giving medical agents that will help excretion of uric acid from the body, and they are known as uricosuric agents. Example is probenecid. The other agent is you can turn off the faucet. That means you can turn off the production of purines by turning off an enzyme that is key in purine metabolism, that is xanthine oxidase inhibitors. There are two xanthine oxidase inhibitors, allopurinol and febuxostat. You can also decrease the water or urate load in that bathtub by actually removing out water bucket by bucket from the bathtub, and this is through uricase inhibitors or pegloticase. And this is what I mean by different actions of these chronic therapies of gout. So if you remember our purine metabolism and uric acid production from our slide 2 deck. So basically you get dietary purines and endogenous purines produced in the body which undergo metabolism to form uric acid. Xanthine oxidase plays a big role, and if you inhibit xanthine oxidase, you will get less uric acid production and therefore lesser chances of getting a gout attack. Does that make sense? Hopefully it does. The other mechanism of getting rid of the uric acid pool is excretion through the kidneys, and you can give uric acid drugs like probenecid. The other mechanism of action is converting uric acid to a more soluble form that can be excreted. This form is known as allantoin, and pegloticase is a medication that helps this conversion to allantoin. So this is how you can get rid of the uric acid load in the body and therefore prevent further gout attacks. Some of the foods to avoid to eat with gout are shown in the center of the figure. That is red meat, seafood, liver, beer, tuna, etc. The products that could be eaten are cherries, vegetables, skimmed milk, dairy products, whole grain bread. So on the left side you see items that could be eaten, while on the center you would see items that should be avoided in gout. And hopefully you understood the basic principles of treatment of gout. If you have any questions, feel free to leave those on this link. Looking forward to your questions. Bye.